there any evidence yet of people developing symptoms post the treatment? Developing sort of new MS symptoms, do you know?
So I looked this up yesterday because there's not a trial I'm involved in, but the Sheffield trial was saying that 80% of people at 4 years haven't had a relapse.
Right.
That's really good.
Yeah.
It does mean that 20% of people did.
Still did, yeah.
Yeah. So it's not perfect, but you know it's a good start.
Yeah.
And I think it's like any drug trial. Nothing is perfect, and you have to say, well, okay, what are the people who benefit most?
Yeah.
Who are the people who are more risky? And I think that's the other thing to make sure, and it's very clear on the Sheffield website, is that it didn't work for people with progressive MS.
Did it not?
No. I think that was very clear. And in a way that makes sense, because we know that the immune system is most involved early on in the relapsing remitting stage, and that's where you need to suppress your immune system. That's where all the drugs do. You know, they all suppress the immune system in different ways, and that's what the transplants are trying to do. But we know that when you get to the progressive side of MS, the inflammation is less important, the immune system is less important, and it's all seems to be related to the nerves themselves down the back.
Yeah.
And that's where we want to do the myelin repair side of things, because if we can then put the myelin back on the nerves, that will hopefully stop them from dying back and stop people getting worse in their disability.
Yeah.
And so it will end up, in my view, as a two-pronged attack on MS patients. So initially with immune system modulators, whether they are drugs or stem cell transplants. And then later on, it will be the myelin repair side of things. They may overlap. You may end up with the time well being on both, so that you can suppress the immune system and repair your brain in two different ways. And I think we're doing much better at the first bit, and we are getting there with the second bit. And, it's much more exciting. Lots of drugs now going into trial for that side of things, but as I said, difficult to measure, difficult to do, because we have to get the drugs into the brain. The immune system, you don't need to, because the white cells are travelling around your blood, so you just, as long as it gets into the blood, you're fine. But in this one, completely different, and should be seen as a separate therapy, I think. Immune therapies, repair therapies. And so you may well be on both as an MS patient ultimately, but attacking two different bits of the disease. That's my prediction.